Welcome to the Heart of Health Equity. My name is Ashlei Rodgers. I'm the host of the show. And today I have a fabulous guest, Dr. Amutah-Onukagha. Welcome. Thank you for being
Thank
here.
you. Thanks for having me, Ashley. I'm excited to be on your show.
You are the founder and director of the Center for Maternal Health and Reproductive Justice at Tufts University. That is amazing because I know
Thank
this is like the
you.
first center for Black maternal health in the country. Even
Yes,
though our numbers are really high and we're unfortunately dying at an all-time rate, I'm
yes,
so happy to hear that there's a center that's actually going deeper into how to resolve these issues.
yes.
Can you tell me a little bit about the center and like how you got started?
To tell you a little bit about the center. So I started the
Mhm.
Center for Black Maternal Health and Reproductive Justice about 2 years ago. It really is the outpouring that came from the work I've been doing previously in maternal health. So I run a large conference every year during Black Maternal Health Week. This is our seventh annual conference being held this year on Friday, April 5th. It's focusing on the role of technology and addressing maternal health inequities. So we'll have a lot of Black female tech companies coming to speak and talking about their digital health, their wearable devices, their AI, and how they're working to address maternal health inequities. So the center really was the outpouring that grew from the conference, which started in 2018, the Mother Lab, which started in 2020, and then the center, which started in 2022. And so it's just the kind of culmination of the work that I've been doing in advocacy and research focused on maternal health inequities, and it's grown to a full service center now where we have 6 units or 6 departments. I have a full-time administrative core. I have a number of students, postdocs, and research interns. And also, we have a lot of opportunities for collaboration with the community.
Oh, everything I'm just like, yes, yes, yes. Everything you're saying is great. I
Thank
do
you.
have some questions. I know you mentioned that acronym, the SMM. What is that
Oh, yeah.
exactly?
So SMM is so the two main acronyms we use in maternal health are SMM, severe maternal morbidity, and
Mm.
MM, maternal mortality. Severe maternal morbidity is a complication that occurs either during pregnancy, at the time of delivery, or in a postpartum period. It's something that is life-threatening for it to be considered severe. And then I'll also define maternal mortality, which is the death from a maternal event. And we know that in this maternal health inequities that we're looking at, the majority of maternal morbidity and mortality occurs in the postpartum period. So about 53% of maternal mortality occurs in a postpartum period. About 22% occurs during pregnancy, and about 25% at the time of labor and delivery. And so these are the three kind of periods that we use to mark severe maternal morbidity and maternal mortality.
Okay, so that's my next question. Like, why are the numbers so high? Because I know the stats are there. Again, I think a lot of people are shocked when you hear that it doesn't matter if you're high income, if you're a Black
Mhm.
woman, high income, high education, we still have poor outcomes and maybe a poor, non-educated white woman in a rural area versus someone
Right.
who's living in a big city who
Right.
has all the money in the world and they're still having issues, i.e., Serena
Absolutely.
Williams, right? So, like,
Yes.
why are the numbers so high for us? And why can
Right.
we not survive childbirth, excuse me?
Well, so two things. One, 84% of maternal deaths are preventable. Two, the maternal death rate is increasing, or the maternal mortality rate is increasing for all groups of women, not just Black women. Although Black women have the disproportionate burden, we do have the highest rate, followed by American Indian, Alaska Native, but the rates are increasing for everyone. And so I think that's really like the canary in the coal mine when you think about the situation, because for all maternal deaths to be increasing shows that we are failing all birthing people. We're failing Black women more, but we're failing all birthing people. And I think when you think about it in particular around race, and as we mentioned, high profile cases of women that have excellent resources, excellent insurance, are delivering at the best institutions in the world, like a Beyonce, like a Serena Williams, they still faced life threatening complications. Serena actually had a pulmonary embolism that was forming in her lungs that if she had not really advocated to get a CT scan, would have erupted and killed her. And this is a global superstar athlete. This is, Serena doesn't
Right.
just belong to the United States, she belongs to the world. She's that skilled, right? And to think
Mm,
about how racism showed up in her delivery, and the nurse told her that she was just tired and didn't know what she was talking about, as if she's not a global athlete who is trained to know every part of her body, as
right.
if this was not documented in her medical records that she had a history of blood clots, and this was something that should be prioritized upon delivery. She had been on medication for it, but because she was pregnant, she had to stop the medication. And when she started having that chest pain, she knew what it was.
Mhm.
So This is, there's not enough education, there's not enough socioeconomic status, there's not enough upward mobility to buffer Black women from the impact of racism. And when you think about it, the field of obstetrics was really predicated on racist ideologies and racist practices. Thinking back to the early days of obstetrics and gynecology, there was someone called Dr. J.Marion Sims, who up until recently was giving a lot of credit for his
Yeah.
gynecological techniques, the way that he's able to repair fistula. We are still using the procedures that he perfected today. How to repair fistula, which is a fissure that happens, sometimes either during childbirth, or some people have them and get them from other ways, but it's a way to repair a small opening that happens between the anus and the vagina or cervix, right? And so this
Right.
opening is something that needs to be repaired. How do we know how to repair a fistula today? From the work of J.Marion Sims. How did he learn how to repair a fistula? He learned how to
Yeah.
repair on the bodies of Black enslaved women. These
Right.
women, there were up to 12 of them. We don't know all of their names. We only know three: Betsy, Lucy, and Anarcha. These
Mhm.
12 women were held in a makeshift rinky-dink hospital behind his house. I'm sure it was horrendous. No anesthesia, no sedation, and he just performed these surgeries on their bodies over and over and over and over and over and over and over again. This is how we also know how to use a speculum. The size of a speculum that's used in a cervical exam, gynecological exam, when a woman goes for her annual pap smear or you're getting any type of work done. This is how we know the size and the structure of a speculum. And so this is the history of reproductive health in this country. This man went on to gain a lot of accolades, make a lot of money
Mhm.
by doing these surgeries on wealthier white women in Europe who received sedation, who were consented, who had their reproductive issues taken care of because of the sacrifices of Black women. And I think when you think about the field of medicine and obstetrics, if I work in a medical school, if you talk to most medical students today, not most of them, some of them will still tell you that Black people have thicker layers of skin.
Right.
Black patients are more likely to withstand pain, that Black patients have higher pain thresholds. Black patients are more likely to embellish their symptoms, which causes clinicians to dismiss or underdiagnose them.
Mhm.
And so this is the field of medicine. It is inherently racist. Up until recently, the American Medical Association had not really reconciled with their racist history. Same thing with American College of Obstetrics and Gynecology. They're
Mhm.
currently doing their work because now it looks crazy if you don't. We're on the heels of a COVID pandemic, a global pandemic, which disproportionately burdened minority communities. We also witnessed the killings of George Floyd and Breonna Taylor and Ahmaud Arbery. All this happened at the same time. And so now there's a racial reckoning, if you will. I hope that it's permanent, but these large
Same.
organizations are really having to sit with their racist histories and their racist tendencies and their racist practices and really take ownership for the damage, the tremendous damage that they have caused as a result of the way that clinicians have been trained. This is why we're seeing these outcomes today. It's not because we don't have technology. It's not because we don't know how to, do medical advancements and we don't have the resources. It's because the entire system of healthcare delivery in this country is racist. And Black women are disproportionately impacted by that, are disproportionately not safe in those conditions, are disproportionately more likely to have their cases and symptoms dismissed, which increases the likelihood of complications, missteps, death, preventable death. 90% of maternal deaths from hemorrhage are preventable. So why are people still dying from maternal hemorrhage in this country? And then you look at sepsis, which is an infection that
Yeah.
occurs, right? And so sepsis is killing people, and
Yeah.
it's a top 10 leading cause of death. This is
Mhm.
medical negligence. This is medical negligence that's exacerbated by the racism in the healthcare system. And so this is why the maternal mortality rate is so high. It's a very clear correlation between the racism and the ideologies that clinicians were trained in and how they carry out their practice, and the impact that we're seeing in reproductive health of Black and brown women in this country today. It's a clear relationship.
I have so many things. I have so many
I
questions with this.
know.
One from like because I know you're at Tufts University and at
Yes.
the medical school. Like,
Yeah.
what is being done from the educational standpoint to make sure they're getting it right? Of course, you have your center at your school, but there are tons of other
Yes.
medical schools that are
Yes.
maybe not as forthcoming and talking about the
Mhm.
systemic racism that's like intertwined in
Yes.
their
Yes.
educational,
Yes.
like, education, like the curriculums, right? So like
Yes.
what is Tufts doing specifically? And have you seen a
Yes.
movement across the country and other
Absolutely.
medical schools? Like what does that
Yes.
look like?
Yeah, so for me, I think, outside of my role as the center director, I also am a dean of diversity, equity, and inclusion. And as part of my role as a dean, there's two other deans in the medical school that focus on equity and inclusion. We're really trying to create opportunities for revamping medical education for our students. So we developed a curriculum on anti-racism that we use to train our second and fourth year students on how to be actively anti-racist, how to serve as an ally, a co-conspirator, and also how to hold space for our students of color who are constantly re-traumatized when they are in their clinical rotations, when they're rotating through a hospital or they're going through medical school and doing these electives, and people are thinking they're here to take out the trash and they're actually a third year medical student. Like all the ridiculousness that happens is still being
Mhm.
perpetuated. And so, how do we create opportunities for our white students to really tap in and understand that they're unmerited privilege, and the way that the universe has been set up and this country has been set up to unfairly advantage them? Like that's something that a lot of them have never had to grapple with. The fact that they're going to this private white medical school, that maybe they had a family member that went to that medical school, or maybe they had some type of unfair advantage that allowed them to be in this position of privilege. How do you use that privilege for good, for a social justice mission? And if our students of color, how do we honor the labor, the trauma, the pain, the racism that you've endured to be able to make it into a school like this, and for you to be able to navigate these clinical practice? And as you're going through your training, medical school is not easy, right? And so we have
Right.
these students who are kind of in these dichotomies, and how do we get them to understand their shared humanity and support each other, and really training white students to actively call out racism when they see it, particularly because of the privilege and the buffering that they will receive upon consequences happening from that racist encounter. So we're working on that. As far as a national movement, the AAMC, which is Association of American Medical Colleges, the governing body for medical schools, has taken up anti-racism and social justice as one of their premier priorities, and is putting out a series of trainings and opportunities to engage the entire medical school community across the country in its actively anti-racist framework. And so I'm really encouraged about the work that the AAMC is doing, because they're creating opportunities for changing the way medical education is delivered. It's a very structured program. The students are in these rigorous blocks, and there's really not a lot of places for them to go through and think about, where do I even learn about anti-racism? How do I even get an understanding of DEI or DEIB, diversity, equity, inclusion, and belonging? And so we're really trying to be intentional about how their program is structured, what they have access to, what we're exposing our students to, because when they graduate, they're going to be bedside and going to be seeing patients, and we want them to be able to feel comfortable and proficient and culturally humble in situations where where they're coming up against or coming into contact with communities that look different than them. I do want to give a shout out. I just got this book. I'm going to be reading it on the plane when I travel, but this is
Ah,
Legacy.
yes, I love
Yes,
her
by
so
Dr.
much.
Blackstock. And so shout out
Yes,
to Blackstock, who is a
everything.
clinician that really walked away from academic medicine because of the depths of racism that she was experiencing, and is using her platform now to really shake up the discipline of medicine. I'm so proud of her. She's a rock star. But this is what we need to see. It's like the culture of medicine holding itself accountable. There's a
Yeah.
lot of, I'm sure she gets a lot of bad emails, let me just say it like that, from
Mm-hmm.
other
I'm
colleagues who are
sure.
like, you're going against the grain, you're
Mhm.
putting the field of medicine out there. That's what we need to break down the racism in the discipline of medicine. If all medical doctors hold themselves at the same standard of, oh, we do no harm, we treat every patient the same, and you report things to these quality improvement boards at the hospitals, this is doctors policing other doctors, right? This is why things are not going to change. But when you have people that go against the grain, that are also from that culture, now we can start to make some real change. So this is like a whistleblower book. And I'm sure, for everybody like me who's a public health person that's excited, there are two or three medical doctors that are just up in arms about it, because she's really calling out their discipline. But that's the only way we're going to get in front of it. This is why Black and brown women are dying, because there's a culture of silence. There's a
Yeah, that's
culture of
100%
racism
right.
being upheld in the field of medicine.
I have to say, Dr. Blackstock, I've been fangirling her on the side. Like
Oh yeah.
every LinkedIn post she has, I'm like, yes, like
Yes.
support all
Yes.
the things. Her and her sister, for y'all
Oh
who
yeah.
don't know her,
Yep.
she's actually a twin,
Yeah.
and her sister is also a physician. Her mom was a physician. Her
Yep.
mom
Yep.
passed when she was much younger,
Yep.
and they're Harvard graduates as well. So she's like
Yep.
all within the system, and it's calling it out. And I pre-ordered her book, so
So good.
I'm like
Yes.
excited to read it as
Yes.
well.
Yes.
But yeah, she's amazing, and I'm
Mm,
glad that
amazing.
she is she feels strong enough and safe enough to be able to go against the grain, because I think that a
Mhm.
lot of people may have said something in the past and they
Yep.
lost their job, or
Oh
they
yeah.
lost their livelihood, or
Oh yeah.
something happened where they weren't able
Oh
to
yeah.
progress in their career. And so some people have remained silent because of
Yes.
that, which
Yes.
isn't fair. It isn't fair.
Not
Like,
fair.
we're
But the
vulnerable
system
already.
thrives. The
System
system
thrives.
thrives on that. And if this the
Yeah.
system banks on the fact that people are not going to want to lose their livelihood, it really it kind of gets its energy, and that's how racism continues to
Yes.
grow and get bigger and more insidious, because
Hmm.
it understands that people are not going to go against the grain because of their livelihoods or their reputation or their career. This is how racism continues to permeate the field of medicine.
100%. I'm just like,
Mhm.
preach, preach,
Yeah,
say it a
yeah,
little for those in the back. Did y'all
yes.
hear that? Because that's real. That's
That's
real.
right. It
I
is.
appreciate.
It is.
See, this is reason 532 why I wanted you on the show, because
I
you
know.
get and you call it out, and I appreciate that. And I do have a question too, as we're talking
Okay.
about from a maternal health standpoint,
Mhm.
um, and advocacy, and like, there's one thing about advocating for yourself, but if you're in this predicament where you're about to give birth, you're not your full self because you're just trying to
Yep.
survive.
Yep.
There's a big movement right now, even though doulas have been around for a very long time,
Yeah.
i.e., like so have midwives.
Yep.
Now there's a big push for women of color to have doulas in the space, so they
Yes.
can advocate for them when they cannot advocate for themselves. Can you tell us a little bit about what the Center for Black Maternal Health and Reproductive Justice is doing to help push that narrative and have more access to
Mhm.
doulas? And just full disclosure, I actually trained to be a doula when I was in New Orleans in grad school. Yeah, so like
Wonderful.
I'm a huge advocate for this. So
Oh,
like, go ahead and
outstanding.
yeah,
Oh,
what's the
that's
story? What are
wonderful.
y'all doing for that, for
Yeah.
doulas?
So first of all, I absolutely love doulas, and you're right. Doulas are having a real moment right now, and it's very overdue.
Mm,
I think doulas who are trained birth professionals that support the birthing person in labor and the postpartum period, even in the prenatal period, are incredible conduits to reducing inequities and saving lives. The reality of it is that people that do have doulas have better outcomes, are more likely to breastfeed, initiate, and sustain it, have less intervention, have less episiotomies, are less likely to have a low birth weight baby. I mean, the list goes on and on and on about the benefits of having a doula. Here at the center, we are working with doulas in a number of ways. One, we have active research projects where we are integrating doulas into the research study design. One of my main doula partners, Christina Gable, is a co-investigator on a large study that I run, and she's running a whole part of the study that's focused on community-based doulas, which I think is incredible because a lot of doulas are not really primed for that academic medicine route. And so being able to partner with community doulas who have the expertise and the knowledge, and frankly, are really an integral part to the success of the study has been really nice to see. And so that's one study that we're doing with doulas, looking at the
awesome.
impact of community-based doulas. We're also working with another group of doulas on so here in Massachusetts, we just got doulas reimbursed as providers. So that's about 2 months old now, which is incredible. And so we got a grant from the Attorney General's office, the first ever Black Attorney General for the state of Massachusetts, Andrea Campbell, gave us a maternal health equity research grant to focus on the toolkit to help doulas navigate the process of getting reimbursed, of registering with Mass Health, and really walking them through the health insurance onboarding process. So we're putting together a toolkit for that now to help doulas kind of navigate the process and frankly get the resources that they deserve. And so doulas are amazing, and I love working with them. And I appreciate their support and leadership in this research space, because I think a lot of time as academicians, we think we have all the answers and we know how to write the NIH grants. But I think really centering doulas who are very close to birthing people and patients, they're right there in the labor room, they're right there at the home birth, they're right there, alongside their patients and their families. I think that really is where the solutions are going to come from.
I love that you're integrating them into the research, because I think that's
Yes,
also another thing. I feel like they've been left out. Like they've
they
been doing the
have.
work, doing all the stuff, but they
They
haven't been
have.
included like in the conversations and been a
Yep.
part of the research. And so
Yep.
that makes my heart smile. And I know also this movement about getting doulas reimbursed is across the
Hmm.
country. Like There
It's
are
everywhere.
several
Oh,
other
yeah.
states that are doing it, which is
Yes.
amazing. Because I
Yes.
think a
Yes.
lot of times when people think of doula, they think of maybe a rich woman and like
Mhm.
mainly rich white women who
Mhm.
had
Mhm.
access to them, who could afford them, but now
Yep.
there's more access and it's fair for both
Yes.
parties,
Yes. Yeah.
which
We're
is
changing that.
awesome.
Yeah. I mean, listen, when I had both my kids, I paid out of pocket for a doula. And I think you're right. There is a certain level of access that's afforded someone who's able to do that. But now, when everybody can have access to doulas, and a lot of hospitals here in Massachusetts are offering pregnant women a doula. As soon as you come in for your prenatal appointment, do you have a
Amazing.
doula? Let's connect you to it. I'm like, yes, that's what I'm talking about. So we've come a long way in a very short amount of time because there's a national push. And frankly, we're in a crisis, right? Like anything we can do to save lives, anything we can do to bring this maternal mortality rate down, we are really being held accountable as a field, as a discipline of public health and medicine. And so I'm really, really happy to see doulas getting their due and getting paid what they need to be able to survive and to feed their families.
The next question too is we're talking about, reproductive justice.
Mhm.
I don't know, that's a word that's coming around, we're hearing a lot about, but some people don't know what that is. Can you
Yeah.
explain what reproductive justice is
Mhm.
and how people can be a part of the movement?
Yeah, reproductive justice is the prioritization of, it comes from the social justice movement with the focus on reproductive rights and reproductive health.
Mhm,
You're thinking of the work of Loretta Ross, you're thinking of Sister Song, you're thinking of all these
mhm,
pioneers in the field of RJ who have done incredible work to really highlight the intersection that Black women in particular sit at, which is gender and reproductive health and race. And so reproductive justice is a discipline that is gaining a lot more traction because it takes a social justice approach to reproductive health. We, as Fannie Lou Hamer used to say, we're sick and tired of being sick and tired. And I think people are really in a space of awakening. And so the RJ movement is gaining a lot of traction and a lot of steam. And as it pertains to what's happening in the country and the world, really, women are getting a lot more traction in the spaces that we need, particularly because we have to fight for ourselves and do it for ourselves. And so I think the RJ movement is one of those big pivotal movements that we're going to continue to see getting a lot more traction, getting a lot more steam. And as it pertains to something like, maybe Roe v. Wade being overturned, I think that's
mhm.
important because we're just compounding our problems here, right? Like you have this amazing
Yes.
reproductive justice movement, and then you get Roe v. Wade being overturned, and now we're seeing more maternity care deserts. We're seeing less access to care. We're seeing more provider shortages. We're seeing less ability to access necessary abortion care. So we're just compounding the maternal health issues that we're seeing, and we absolutely will see an increase in maternal death, particularly in Black and Brown communities or maternity care deserts where patients have to travel further to access
Mhm.
the care that they need. So that is one of the things that reproductive justice is really trying to hold the system and the country accountable is how are we prioritizing our birthing people and our people in rural populations to make sure that they're able to get access to quality care when they need it.
I love that you mentioned Roe v. Wade because that was my next question. I know that something relatively, it's, in the past year that the Roe v. Wade was overturned,
Mhm.
and abortion rights have been sadly eradicated in a lot of states across the country. I am from Texas.
Mhm.
There is Texas. I feel like Texas and Florida are like going neck and neck. It's like hold my beer type vibe
Yeah, 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 yeah.
constantly. But I'm
Yeah.
from Texas, and this, I side eye my governor often. But with that said, there are a lot of women that no longer have access who do not have the means to travel out of state to get
Right.
the care they
Right.
need.
Right.
And I know recently there was a woman who wanted her baby, but she needed an abortion, and that was a whole other issue where
Mhm.
she actually had to leave. Like it was like I think the state Supreme Court decided that she wasn't able to have it, even though the baby was
Mhm.
going to die inside of her, I believe, and she wasn't able to get the abortion. So it's a whole other thing. With that said, she was a white middle class woman too. So you're like, what does it mean for the rest of us? And as a Black woman who has yet to have children, but hopefully has a child, in like the coming years,
Um,
I'm genuinely scared to
yeah.
have a child in
Yeah.
Texas. Like,
Yeah.
I'm
Yeah.
already thinking of a birth plan to not have a child
Yeah.
in Texas because
Yeah.
I am nervous that I may not make it, which is
Yeah.
really upsetting to say out loud, but it's
Mhm.
true because
No,
there are
it's true.
women who are from the same economic background as I do, educated, whatever else, and do not make it daily.
Yes.
So, what I know we talked about this, privately, there what can people do when they're in these states that they may not have access to all the level of reproductive care, but also
Yeah.
Like, what are our options? Like,
What are the
can you talk
options?
about that?
Yeah, well, thank you for sharing that. I mean, I do
Yeah.
think that we have a couple outliers. You know, Texas and Florida are pretty scary places right now. A
Hmm.
couple other states in the South. You know, I really have to feel like two things are going to have to happen because we will see an increase in deaths. There will be an increase in unnecessary excess deaths that are completely preventable from this Roe v. Wade being overturned and being in an abortion restrictive state. I do think that there are people still providing it. It's really not something that is heavily publicized, but people are still providing abortions. People are still getting good prenatal care. But the problem is that it's such a backed up system because the system is really swelling because there's lack of providers. Obstetric providers are moving to states where they can do this type of work that they want to do. And so that leaves a really bad shortage in certain parts. So I think if you're in a large metropolitan area like a Dallas, a Houston, Fort Worth, you might be okay. But when you get to the rural parts of Texas, it's going to be very problematic. I'm really hoping that things will change sooner than later. It's all about the who's in leadership, what's the administration at the time, because that who really sets the tone. But there are things that are still happening. There's mom and pop organizations. There's lots of community-based programs and organizations who are really fighting this because Texas is such a big maternal health state and it's such a big state in general that there is a lot happening. And so I'm happy to share some resources offline about some of the projects that I know are happening. I mean, but we do have parts of Texas that are pretty critical and are going to continue to, like, you know, the border area, El Paso, places like
Yeah.
that are going to be very critical as it pertains to maternal health and pregnancy. But you know, larger metropolitan areas, that's going to be a little bit easier to access care. But we know that BIPOC people and Black women in general who live in these rural parts of the state have to travel further, and it requires a concerted effort and a system. So I mean, you know, there's work being done to change some of this. You know, Center for Reproductive Rights and other advocacy groups are really working on it. But I would hope that, you know, either between one, a change in the leadership, or two, some federal legislation that comes out maybe through the Momnibus, we're able to really make some inroads because um, it's dire. I don't want to, I'm not trying to clean it up in that way. It is dire, but I'm hoping that with a lot of the work that's been happening, a lot of advocacy work is happening in Texas, there will be that makes some substantial changes.
Oh, I hope so. I pray I
Yeah,
hope so because I know the
yeah,
numbers are only getting worse.
yeah.
Every day they're getting worse, and there are stories that we'll never hear of where women
I know.
are dying or doing some really drastic things to try to get proper reproductive care,
Hmm.
which is upsetting. So I know we've talked a lot about business, but I want to talk about you as a Black woman who's a boss with a capital B, doing all these things. Like, how are you, like, what drives you besides, being a mom and being a Black woman? Like, what else drives you to continue to do this work? Because I know it's tiring. It's
Yeah.
a lot constantly, as you're talking about being a leader and being vulnerable. Like, what continues to keep you going?
Yeah, I mean, definitely my kids. I have two beautiful kids
Mhm.
who are just, you know, amazing. Of course, every mom thinks their kids are amazing, but my kids are actually perfect. You know, besides these, you know, these two beautiful boys I have, I am propelled to make a difference because I represent people who are no longer here to tell their own story. And I've
Mm.
lost friends to this. You know, I lost a friend of mine when we were teenagers. I was 16, she was 15. This was in Trenton, New Jersey, where I grew up, and she died from complications after having her daughter. She had lupus, which exacerbated her pregnancy and made it more difficult. But now I know that Black women who deliver in minority serving hospitals have less access to resources and are more likely to have poor outcomes. And that's exactly what happened to my girlfriend, Waikia Moore. And so, you know, losing a friend at 16 when most teenagers are planning a prom and, you know, thinking about college, and you're at a funeral, you know, that those moments really kind of bookmark your life.
Mm.
And then losing another friend as an adult when I was in my late 20s, early 30s, I was finishing my postdoc, which is a research fellowship you do after you finish your PhD. And I worked with Dr. Shalon Irving, and we would go to lunch together in, Inner Harbor in Baltimore. We go down to Lexington Market and get some food. And Shalon always wanted to be a mom, right? I think my maternal genes kind of kicked in probably early 30s, and I was like, oh, I think I want kids. But she was already there when we were
Yeah.
postdocs. She always talked about being a mother and having kids. And I remember when I found out she was pregnant with Soleil, I was so excited for her. And I remember when I got the call that she passed, and I just was like, I feel like, you know, I just got punched in my chest because I'm like, you just had this baby, right? And now we know that, the healthcare system really failed her. She had been seen 8 times upon discharge,
Wow.
8 times before she was readmitted. And by the time they readmitted her, it was too late and we lost her. And now her mom, Miss Wanda Irving, is raising her granddaughter. And I am happily serving on the board that Miss Wanda created an organization called Dr. Shalon's Maternal Action Project, DSMAP, based out of Atlanta. And, we'll be in a board meeting and I'll see Soleil running around in the background. And it's just such a constant reminder of the work that we're doing, right? I mean, Shalon should be here to raise the child that she's always wanted. And so this work is very personal to me. It's very critical to me. I represent the voices of a Waikia, of a Shalon, of a Shanice, of so many other people, Dr. Shanice Wallace, who died at the hospital that she worked at, right? She was a pediatric resident in Indiana. She died at the hospital that she worked at. And she was a doctor.
Disturbing.
It's unconscionable, right? And
Wow.
so my work, I am a vessel for these women, for their families, and for myself. I'm a Black woman with lived experience. And, as we continue to think about expanding our own family and the family that we already have, I've had some interesting experiences in my own labor and delivery, right? Because when you're on that table or you're in labor or you're getting prenatal care, nobody cares about your titles and your accolades and your deanships. You're a Black
Right.
woman navigating a racist healthcare system. And I still experience the microaggressions and the dismissals. And so it's very personal for me because I'm not just talking about it, I'm also experiencing it myself. And
Hmm.
I know what that means, right? I know what the delay in care means. I know what the dismissal means. I know what the ignoring symptoms means. Like those things can be really critical for people and really can make the difference in someone living or dying. So, I don't have the luxury of kind of hanging this up at 5 o'clock and kind of saying, all right, that was a good day's work. I am Black all day long. I have a beautiful, long Black name. I have beautiful, long, Black children, a beautiful
Right.
Black husband. So this is a very personal 24/7, 365 mission for me. And I also would be remiss if I didn't talk about because of the work that I've done in legacy that I'm creating is really creating hope for the next generation, right? I have an amazing staff of young Black women who are, late 20s, early 30s. They're, looking for love and want to start their families. I get that. I was there just a few years ago, but they see me as like this beacon of hope, right? Like she has this amazing
Mhm.
career, she has a family, and she's still living her truth and her mission. That makes it attainable for people. It's like, okay, Dr. Moots is doing it. I can do it. And I'm like, yes, honey, you can do what I'm doing and then some. So I do recognize that my leadership in this space is not just professionally, but it's also personally. And I get emails all the time from people who are like, oh my gosh, I'm a fan of your work. I love your work. Thank you for doing what you're doing. So I am always appreciative of that. I appreciate being used by God in this way to be a vessel for his work and his mission. And I also always carry with me, my friends that I lost who should still be here to raise their kids. So it's personal for me. And frankly, the last thing I'll say is that I do feel strongly that the people who are experiencing it are the ones that should be coming up with the solutions. Whether that goes for where the funding goes to, these large organizations who are funding investigators who are not from communities of color, who do not have lived experience, but are making their careers, making millions of dollars, publishing papers. And not to say that there's not enough room for everybody, but I do think that the leadership of this movement should be disproportionately from Black and Brown communities because that's where the burden of racism lies. And so that's another reason why I stay in this fight. And I'm not sitting in the industry making $500,000 doing nothing. I'm in
Yeah.
this fight because I want to be on the front lines and I want to be a visible force so that when people come, they know that this is being done by people who actually care about the topic.
I mean, just drop the mic from there. Like that was that was I mean, honestly, like I resonate with you about losing, friends and families to, to that. And I'm so sorry about that because it happens all the time. A lot of us know someone,
Yes.
at least one person, right? Two, I also am fangirling you on the side. I'm gonna give you your flowers.
Thank you.
No, because you
Thank
are
you.
you are doing
Thank
the Lord's
you.
work for sure. Like you really
I
are. And
am.
I
I
agree
am.
that us seeing you in these spaces also gives us hope. And that's me and as well. Like I'm kind of like, oh, I want to get my PhD. Like I see
Yes.
someone doing it, like all
Yes.
the things. So like
Yes.
I appreciate you. Like I don't think, I mean, I hope you realize how much of an impact you're making for those you may not even interact with. Like, it's a really big deal. And you're also saving lives for women that you may never meet. So,
Mhm.
thank you for everything that you're doing. Like, it's a really big thing. And I just hope that as you are being a superhero, doing all the things, that you are practicing rest, because I think rest is a
Yes,
revolutionary act.
it
And as
is.
Black
It is.
people, we constantly go out and do.
Yes.
But like,
Yes. Yes.
when are you pouring into yourself? And
Yes.
that's one of my questions I ask a lot of the leaders that I meet. Like, what is your form of self-care? Like, what are
Yeah.
you doing to pour into yourself? Because you
Yeah.
give so much all the time.
Thank you so much for asking that. So
Yeah.
I have a couple things that I do. I lead my team. I lead through example. I tell my team, listen, you're never gonna have to worry about hearing from me on the weekends, on the evenings. I don't even know you on the weekends and evenings. I keep very tight boundaries because I have a family and weekends and evenings are for my family. I'm very intentional about that. I try to work when I'm working and I'm home and I'm offline when I'm with my kids and my husband. I build in our date nights. We're still dating each other. Today's
Right.
Valentine's Day, so we had a whole moment this morning. I was like, oh, I'm still in love.
I
But
love that.
I really feel that to have longevity in this work, you have to be able to distance yourself a little bit. And so I have a Peloton. Anybody wants to find me on the Peloton leaderboard? My name is PH Diva 0618. I love my Peloton. I make sure I do that. I do the self-care. I'm always gonna have my nails done, my hair done. I get my massages, I get my facials. I do my girlfriend's trips, right? And I'm very intentional about being a priority for myself. I have to be here for all the roles that I have as a wife, as a mother, as a leader. And I'm no good to anybody if I'm broke down, crippled up, angry, depressed. So,
Fact.
I make sure I get what I need. I take very good care of myself. I'm a soft life girl. And you don't gotta worry about that, honey. I got that memo.
I mean, that soft life is real. Like, I
Real,
don't have it
honey.
yet, but I aspire. I
Honey, and
aspire.
once you taste it, you can't go back, right? You're like, oh my gosh, I love flying first class. I love this.
I like nice things too. One
Yes,
day.
yes,
I'm
yes.
telling me, stop calling me about my student loans one
Yeah, I
day.
know, I know, I know. Well, we got those too. But thank you for asking the self-care question because I think this work is very consuming and it doesn't
Yeah,
stop. Actually, I get emails all day long. So much of my time, which is also how I get my cup refilled though. So much of my time goes into mentoring. My mentees are all, and they're not just in public health, they're in nursing, social work, whatever discipline. But I
amazing.
understand what good mentorship does for you. And that's also a self-care thing for me, right? I'm training the next generation of maternal health leaders. Like these scholars are incredible and they're on fire for this discipline. And so as their outside person, can come in and kind of shake up their committee a little bit and say, okay, this young lady is ready to graduate. Let's get her out of here. That also makes me feel really good because I know the academy is very gatekept. It's a very gatekeeping society, mostly by white people, and that white supremacist culture is very alive and well in higher education. And so, for me to be able to get in there and shift the room and say, "This young lady's done. She needs to graduate. We're done." And then, I'm going to one of my students' graduation in Ohio in April. She's graduating from medical school. I've been rock with her ever since, and we will be front and center at that graduation. That's how I get my cup full. That's also self-care for me, is the mentorship and really being there for the next generation of young women.
And this is my final question for you.
Yeah,
What does, because this is the heart of health equity, I have to ask this. What does
yeah.
health equity mean to you?
Health equity means to me that we're not just saying that people have actually the same opportunities and everyone is created equal, but people actually are created equal. When someone walks into a labor and delivery room, they're treated the same, regardless of your background, your race, your marital status, your immigration, your class, your ethnicity, your ability status. That is health equity. Because we know those minor nuances that kind of roll up into these racist encounters. We're not practicing health equity. So for me, health equity is the actual doing of the equitable practice, right? There's an action orientation to the framing of it. It's one thing to say, oh, we want to create a world where everyone should, but then how do we actually do that? That's where I'm at. I'm at that implementation space, right? How do we actually do it so that people are actually treated the same, and then people feel like they have the ability to have a joyful, healthy birthing experience. Until we can do that, and you can walk into any L&D labor floor in this country and have the same outcome and the same experience, we have a very long way to go, because we know humans are inherently flawed and many people are very racist. And so we're not actually, it's an ideal that we are working towards, but I'm really interested in the practice of health equity and how does that translate into care?
I love that. That was a great answer. Great answer. Okay, so I know for folks who are watching, how can they reach you? What's the
Sure.
best way to learn more about you and the
Yes.
Center for Black Maternal Health and Reproductive Justice at Tufts
Yeah.
University? Where can they find you?
Yeah, so a couple different places. Our website is blackmaternalhealth.tufts.edu. Our website for my students, my mother lab is motherlab.org. And then I'm very active on Twitter, PhD Diva 0618. And then also we have, all of our socials, CBMHRJ, Center for Black Mental Health and Reproductive Justice. But I think if you just put our name in Google, it'll come right up. But the main way is through our website, blackmaternalhealth.tufts.edu.
And I just wanted to say thank you again for being
Thank
on the show and bestowing us with
you.
so much knowledge and kindness. And
Yeah.
you're just a great human. So thank you, thank you, thank you.
Thank you so much, Ashley, for having me. It's been a pleasure to be on your podcast today.
Of course. Bye.